My name is Ira Fox. I'm a professor of surgery at the Children's Hospital Pittsburgh of UPMC and the McGowan Institute for Regenerative Medicine. So while I'm an organ transplant surgeon, I have spent probably the last 20 years trying to perfect and study both in the laboratory and in patients how to use hepatocyte transplantation to treat patients mostly with metabolic liver disease or patients who have a form of liver failure that is devastating in that it's an acute injury and that they don't have any history of liver disease. We're also looking in the laboratory for ways of treating patients who have chronic liver disease and cirrhosis, the most common indication for organ transplantation, by transplanting cells as well. My background in research actually spans a lot of different areas. So originally I was actually an immunologist, but in the process of studying immunology and doing research in immunology, I became interested in gene therapy. And while I was in the process of doing gene therapy, we started working with a gene that was able to sort of immortalize cells. So we were immortalizing lymphocytes and studying lymphocytes in tissue culture, but we also immortalized hepatocytes, and we realized that we could actually immortalize hepatocytes and make them grow indefinitely in a tissue culture dish, but they would stop growing after transplantation. And we studied these modified hepatocytes and found that we could correct the disease. So, and that's what led us to be one of the very first places in the world to do hepatocyte transplantation and to find out it actually had a lot of potential for treating patients. So if I was a parent and I had a child who had a rare metabolic disease and I was surfing the web and found out that there were therapies available at our institution, I would suggest that they contact us immediately and find out all of the possible therapies that are available at the institution.
Our teams of international experts are focused on treating children with rare diseases, defined by leading standards of care, pioneering protocols, and individualized services in a world-class environment. At Children's Hospital of Pittsburgh of UPMC, you are not alone.